I'm a board-certified dance movement therapist and also a licensed clinical psychologist. Over my years working at pediatric oncology units at UCLA and also CHLA, I have had the opportunity to see the incredible support that dance movement therapy offers for this life-threatening illness. We can all agree that patients receive incredible treatment at the hospitals, and they also need extensive support for their emotional and psychological well-being. Dance movement therapy allows patients to be supported in a place of non-judgment and to communicate in a way that's very innate to all of us, through movement. Active or passive, movement is a process in which we all relate. It reaches across languages, cultures, health, or illness, from the simplest heartbeat to your blood flow, your posturing, or more complex movements like jumping, standing, walking. You get the point. So by working with the physiological experience of a person and how the body moves, we can inhibit or increase the emotional states, which ultimately improve overall health. As implied by our knowledge of neuroplasticity, the changes that a patient experiences in a dance movement therapy session and learns can create new pathways in the brain structure, which could reinforce connections and healthy development. Since we know that the brain with our central nervous system is our core, controlling our personality, our senses, and our body functions, it makes sense to use a treatment that for brain tumor cancers that reaches patients and encompasses all of these. Dance movement therapy looks at personality by emotional expression and how things are felt and how we're aware of our body. We look at our senses, how someone feels something, sees something, touch, texture, all the sensory experiences. And then the body function. How do we manipulate our bodies to move, to release tension, to relax, or to make contact with somebody? Patients may have limited ability to have control over their treatment course, their surgeries, their adjunctive therapies. Dance movement therapy, however, allows them the opportunity to gain control over their bodies, to understand their individual movement profiles, and ultimately transform their emotional states. The patients can advocate for preferred ways of contact, and also in terms of how they're being engaged with for getting their vitals taken or getting shots. With extensive movement research, our field has derived a framework for describing movement that captures universal patterns of efforts, which exist on a spectrum from moving with different motions, such as quick and slow or strong and light. Not only the muscular movement for like reaching forward, but the intentionality. So the difference between reaching to lift up a glass versus swatting a fly. There's a difference in the intention. A healthy person, I'm sorry, just one more, going back. It's still the light and the strong. So basically a healthy person, the background has showed that a healthy person will have a full range of these effort qualities. So the person will be able to move with all dimensions of these movements, quick, slow, light, strong, as an example. And this makes them more adaptive and flexible in their environment. Whereas an individual experiencing a pathology, or in this case an illness or disease, will have a more rigid profile, in which he or she may gravitate towards one side of the spectrum. With therapy, we can explore preferences of this movement while finding benefit in utilizing all the qualities of movement. So today, you all get to finally get out of your seats. We're going to conduct a movement activity which you can explore your individual preferences for movement for today in this moment. Two qualities of movement that are familiar to all of us, but very specifically really familiar to patients in the hospital, is moving with strong and light movements. So if you don't mind, I know you have a table in front of you. We're just going to stand up, and you can stand in front of your chair, or you can push your chair in, and you can stay exactly where you are. So as you can imagine, in a therapy session, we might have more room, but sometimes we're just in the bed, and we're just using what we're able to do. Today, I know you all are more on the adaptive side, so you're able to get up and stand. So we're going to start with just moving with strength. So I gave the picture of strong can be an image of pushing or lifting, and light is the opposite, blowing bubbles, feather, wind. So strength can be moving with like a bound flow, like you're just kind of shifting, or it can be quick. just kind of exploring what that's like. Your head can even move with strength, very hard and solid. You might even take a moment, I know we don't have a lot of time, but look at the person next to you and see how you share your idea with each other, how you feel like you want to move with quickness. Immediately laughter starts to happen, right? Moving makes you feel lots of things, silliness, tension. So continue to do that. Just when you think you want to stop, find a different part of your body and move again with that strength. If you've been moving with strength and you've been moving quite quickly, move quite slowly. Change the rhythm to it. And be aware of some feelings that are coming up. If you had to identify a word, an image you might remind you of, a story, something that's happened to you. So before we go on, I'm going to put you guys on the spot. Any words come up, any images? Does anyone want to share, throw out into the room?
Fun, relaxing.
Fun, relaxing was strong. Okay. Anything else?
Relieving.
Relieving. So strength was relieving. This ultimate control. Okay. Maybe you can even whisper it to the person next to you if you know them, a word that came up for you. All right. So we're going to switch and just take a moment to move with lightness. So like I said, light can move very slowly or it can be quite quickly. It could be moving light as air, you're blowing away, or it could be... And just notice if this feels different for you. So again, turn to the person next to you and just tell them maybe an image or a feeling or a thought that came up was slow. Was it easy? Was it difficult? Okay, and I just want you to notice, you all are welcome to stay standing or you may sit back down. Thank you all. I want you to notice that you might have had a preference today. What felt more comfortable, what fit you for today. So think about your preference for moving. You can imagine that if you prefer to move with lightness, and let's say a doctor performs a procedure on you and uses a different type of quality. Let's say they use strength to handle you. This may feel uncomfortable to you. This is where it becomes less about the actual treatment and more about the process. So compliance, when patients are in the hospital and the doctors or nurses are concerned, or family members saying there's a compliance issue, the person doesn't want to sit still for this to happen. We see that when you start to learn your preference, you can advocate for yourself and realize that it's not really about that you're not complying. It might be that it's about regulation. It's about what you prefer and how you want to move in that environment. And so it becomes more about a preference for regulation than disobedience or avoidance. I have had many experiences of working with patients and helping them find their individual profiles to help them advocate for, hey, this is how I want to be interacted with, or this is why it was so uncomfortable today, or this is why it felt so enjoyable today. As well as just having the ability to have a place to have control for the first time. Instead of everything being done to them, they get to move and have a place to express what they want to in their body. And if they felt like, hey, it's difficult I can't move fast, well, there's other ways to move. We can move slow. So there's lots of options, and it leads to a lot of emotional expression and ultimately talking about these feelings and having a place to communicate. So there's my information. I know you all have it. I hope you, hope you enjoyed today, and I look forward to offering more dance movement therapy. Thank you.
And my apologies, I didn't introduce Lori properly. Dr. Lori Baudino, psychologist and board-certified dance movement therapist at UCLA.